Hey everyone, so you have already learned how to perform a urinary cath in earlier classes. So in pediatrics, there's just a couple things with urine collection that you may never have seen before. So I want to introduce you to them. So this is a straight cath specimen collection. It's really nice. Some facilities have them now, some other ones don't, but I want you to be familiar with what this is. So with this set, you can see that there is a collection vial here, and it will come pre-loaded for you. There's the catheter, it runs through the cap. And what you'll do is if you're using one of these, you loosen up the cap just a little bit to help with your flow. And then you're gonna clean your area just like you have learned in prior classes. And then you're going to find your urethra and you're going to put lube on this. And then you're just gonna insert this catheter right into the urethra. You should see urine coming into this container. And then the really nice part about these is once you're all done, you can just pull this out all the way. And then once this is pulled out, this kind of collapses. I'm not gonna do it for you here because it is a pain to get back in, and I was fighting with this one, but you just literally pull this out. This goes in the trash. This little cap folds down, and then you're gonna seal it. You're really twist it tight, label it, patient's name, date of birth, date and time of collection, and then you can send this specimen container to the lab. Another unique to pediatrics specimen collection container here is called a U bag. So you can see U bag, it's a bag, and it has this unique shaped sticker on here. So whether you're taking the specimens, is usually for babies that are in diapers. So what you do is you clean the area really good, and then you're actually gonna peel this tape cover off here, and this area goes directly over their urethra. So for boy babies, it's gonna be, the penis is gonna be directly in this hole here, and the tape is gonna surround the skin. Or for little girl babies, you do the best you can, making sure this gets taped all around the labia, in the area of the urethra. And then you're gonna fold this bag up, and then you're gonna close the diaper, and then you'll come back in a little while and you'll check it to see if you've gotten urine in here. Then you're able to peel the sticker off the skin carefully, letting the urine all fall down here. And they usually have a little tab at the bottom that you can pull, and you can kind of see that there is a circle here where the urine can be flowed out into a specimen cup. You just seal the specimen cup and then label it name, date of birth, time, and date of collection. Another catheter you might see here is a catheter set that looks like this. It's a catheter in a plastic bag. You can kind of see that there's like wetness in here. That's the lubricant. It comes pre-lubricated. And to use this closed system, so what you do is you're gonna pop this top off, and the catheter will be ready to feed up through the bag. So everything is sterile. For this process, you would use your sterile gloves, just like you've learned in your previous course. So you're gonna just feed this up here. You'd have the area all prepped already and cleaned. And then here is your catheter. So once you have fed this up here, sometimes this takes 2 people just to have enough hands to do it. But once you have the catheter in and the urine starts flowing, the urine will flow into this collection bag. And then if you need a sample from it, you can pour it out into a cup, or you can just throw it away every time you use it. So I just wanted you to get to see that one as well. And lastly, pediatric patients can still have indwelling urinary catheters too. They would be inserted the same exact way. You just might find that you need a Foley balloon catheter that's a little bit smaller. So just remember that Foleys are measured in Frenches. So you can see this one is a 12 French here. So I think this one is also a 12 French. You will have a plethora of catheter sizes to choose from. Just gotta choose wisely based on the age of your patient, which if you're ever in the situation, you can always ask for help or ask your instructor just to kind of give you an idea and show you all of the different sizes that they have on the pediatrics floor so you can see them. So now that you've seen all of the different types of urinary catheters in pediatrics, I just want you to now get your hands on them, just feel them, see how they work. Feel free to advance the catheters, to twist, pull, whatever I've just showed you how to do. You can practice the U-bag on a baby that we have in the lab. So just get your hands dirty and try to get a feel for them so you feel more comfortable when you go to clinical.